Hi guys, so what do these things have in common? Got some bananas, got some chocolate, got some sweets, got some hot chocolate. They all have sugar, and that's what I want to talk about today. I want to talk about sugar and the effect it has on our body and how it's the leading cause of a pandemic that's going on right now that has nothing to do with COVID-19. Let's talk about you and your diabetes. So first, as usual, start off with definition. So there's different types of diabetes, but today I'm going to talk about diabetes mellitus. So in the clinical setting, diabetes means too much blood in the sugar. You're not supposed to have a lot of blood in your sugar. So the word diabetes comes from a Greek word, and the Greek word means siphon. So siphon is a type of tube that is used to pass water through it, and it's called that because people who have diabetes pee so much. They pee like a siphon. They pee like a tube that's just passing water through it. Mellitus is a Latin word that means sweet. So when you have too much sugar in your blood, it makes you pee a lot, and that sugar comes out in your pee that it makes your pee sweet. As I read this, it got me thinking, how do they know it tasted sweet? That means they must have tasted it. That means people were drinking other people's urine. And I dove into Google, and that's what they used to do. Back in the day, they used to have a urine taste chart. So I went and found a clip that shows an accurate description of what it would have been like to be a doctor at that time. Yes, come in. Hey, boss man, wagwan. Why, hello there, darling. How can I help you today? See, I think something's up for me, because I'm drinking loads of water, and then I'm pissing like a flipping racehorse, like every 20 minutes, every 30 minutes. I'm rushing off to the bathroom. Another thing is, I'm losing weight. I'm not even trying to lose weight. I'm trying to get the muscles, you get me, off. And then I'm proper tired, bruv. I can't even go on the road with Mandem anymore because I just want to sleep. All I'm doing is drinking, pissing, and sleeping. So I don't think something's right here. Well, I think this is what I'm going to have you do for me. I need you to go. I need you to take this glass and just do a little piddle in it for me, if you would, and just bring it back to me when you're finished, okay? No problem, cuz. Pass it here. By the way, how much do you want? I can do a little bit, so you can take a shot glass or you want. Well, not too much actually. I've already drank 5 other patients' urine today, and I'm getting a tidbit full. So just a little bit will do. Thank you. No problem. I'll see you in a bit.
5 minutes later.
All right, here you go. Well, that does look slightly suspicious. Let me have a taste. It has good body with a slightly fruity undertone to it. Oh, and a brilliant oaky afterbirth, if I say so myself. Oh, it is very sweet. Did you put some honey in this, darling? It is very sweet. That's a good thing, yeah? Oh no, chap, that's not a good thing at all. See, I think you might have a touch of the diabetes. And as you can see from this very accurate historic reconstruction, that yes, doctors used to taste their patients' pee, and they used to think they could diagnose all sorts of diseases from tasting their urine. But the one they would get correct the most was diabetes. There was a doctor called Thomas Willis, and he quoted that the urine of someone who's diabetic is wonderfully sweet, as if it was imbued with honey or sugar. This just makes me so happy that I get to study medicine in this era, not at a time when you had to taste people's bodily fluids. Sugar has been associated with diabetes for a very long time. Even Indian doctors would see that urine from someone who's diabetic would attract ants, and even cultures like the Chinese culture, they used to call it the sugar disease. Thankfully for us, we don't have to take urine shots just to find out somebody has diabetes. We have very simple tests. You can take a strip and just dip it in there, and it's gonna detect if there's any sugar. We are now very familiar with the word pandemic. Diabetes mellitus is a global pandemic, and pandemics, as you can see right now with COVID-19, are emergencies. They are health emergencies. 1 in 11 adults around the world has diabetes. That's over 400 million people around the world with diabetes, and almost half of them are not diagnosed. And by 2030, these numbers are predicted to double. So the difference that we're seeing between COVID-19 pandemic and the diabetes pandemic is that COVID-19 is acute while diabetes is chronic. So I talked about this last week, talking about the differences between acute and chronic diseases. So how does diabetes mellitus, which is also known as type 2 diabetes, how does this occur? It's not acute. You don't just wake up one day and you're suddenly diabetic. It takes a long time for it to happen. Some people it takes 20 years, some people it takes 40 years. So for us to understand why it takes such a long time to occur and what sugar has to do with it, we have to look at the anatomy. So there's 3 things that are involved in diabetes. The first is an organ that you have called the pancreas. So this is, it's a long, thin organ that sits behind your stomach and your intestines. And the pancreas produces insulin. So insulin is a hormone. It's a type of chemical that helps regulate our blood sugar. And the final thing is sugar, specifically glucose, which is the basic type of sugar we get from most of our foods. So to understand how these 3 things work, I'm going to first talk about how they normally work and then what happens when you have diabetes. So we need glucose to give us energy. Our body runs off glucose. That's what we need for anything you want to do, from running to walking to just sitting down. Just the normal function of your body comes from glucose. And we get glucose from anything that has carbohydrates. Glucose, sugar, carbohydrates, it's the same thing. But when we take in something that has sugar or glucose, it doesn't directly go into our cells. It doesn't give us that energy straight away. It gets first into our bloodstream. And we're not supposed to have sugar permanently staying in our blood cells. It damages our blood cells, but our body has ways of dealing with that. This is where the pancreas comes in. So I'm going to pretend to be the pancreas. So I'm the pancreas, and this is the blood vessels, and this is your cells. So anytime you eat anything that has sugar, it gets in your blood vessels. Your pancreas, once it notices there's a lot of sugar in your blood vessels, it produces insulin. Insulin is needed to take the glucose that's in your blood sugar and put it in your cells. That's the only way it can get in your cells. And then your cells can use it for energy, for everything that you need to do. And this lowers the level of sugar, of glucose in your blood vessels. So that's what normally happens. So let's say you spend 10 years, 20 years, 30 years taking in a lot of things that have sugar. This means your pancreas is constantly working. So let's say you have something with a lot of sugar for breakfast. Increase in sugar, your pancreas is working, produces insulin to put it in. You have a snack, you have lunch, you have dinner, and this is something that's continuous. Soon what happens is that because there's like almost a constant increased level of sugar in your blood vessels, this means your pancreas is constantly working. This means there's constant levels of insulin in your blood as well. This makes the body resistant to insulin. This means it doesn't matter if there's a lot of insulin, your cells are not going to respond. They become resistant to it. So since the insulin can only put in a little amount of sugar into the cells, it means you're leaving a constant high amount of sugar in your blood vessels. it's not going anywhere because your cells are not taking it in. And because the function of your pancreas is to detect blood sugar, it's like there's still a lot of blood sugar, so it works overtime to produce more insulin. So it's just working and working and working and working, and eventually it stops working. It stops producing insulin. So this means even the little bit of insulin that was working to decrease your blood sugar levels, it's gone. Now you just have a blood that's constantly full of sugar, and you're having cells that are not getting any sugar at all. This is where all the signs and symptoms of diabetes comes from. So all the sugar in your blood, it has to come out somewhere. So it comes out through your kidneys, through your urine, and that's where you get the sweet urine from. And because carbohydrates and sugar attract water, so if you have sugar going out of your urine, it takes water with it. So that's why people urinate a lot. And then because you're urinating a lot, you're thirsty. So you keep drinking because you keep peeing, and you keep peeing because you have too much sugar in your blood. So on this side, your cells, your tissues, they're not getting any of that sugar because the pancreas is not working anymore. This explains why you get tired. You need sugar for energy. People become tired, and your body starts using other sources of energy like your fat and your muscles, so people start to lose weight. And because your body's like, we're not getting energy, you constantly feel hungry as well, because your body knows you get your source of energy from food. So back to your blood vessels. Sugar, glucose is not supposed to be in your blood vessels because it damages it. So it damages the inside of your blood vessels, and it means they're not able to work properly. And it starts causing this damage in the smallest blood vessels first. So people end up getting numb and tingly fingers and toes because it starts working on the smaller blood vessels. Another sign is blurry vision. This is because some of the smallest blood vessels we have are in our eyes. So if it's damaging small blood vessels, it's starting to damage our eyes. And other small blood vessels that we have are in our kidneys. So that's why people who have diabetes for a long time eventually end up having problems with their kidneys as well. So that's all I'm going to talk about in this video, and I know it's a bit longer than usual, but diabetes is a pretty big subject to talk about. So I talked about mainly just like the history and the meaning of diabetes and how it happens. In the next video, I'm going to be talking about the risk factors. So what is it that we do or we don't do that makes us more prone to getting diabetes? And then how can we help ourselves not get diabetes or prevent it, or even start reversing some of its effects? So yeah, thank you so much for taking your time to watch this. I really appreciate all your views. I'll see you next week. Bye.